I'm Dr. Jean-Jacques Deutsch. I'm here to present you the cross-intersection technique. I developed this technique for 1 year now on my patients. I use two threads that are making two V's like this. It is an easy to implement technique that allows to reach a sustainable and natural effect. The good indication for the cross-intersection technique is skin slackening. And you can see on this patient the skin slackening and the good indication. So the traction, we put with the fingers to find the good vectors with the markers. After drawing the markers, we try to have the lift through the hair and behind the ear. So we do a little local anesthesia on the entry points, and we put the needle strictly subcutaneous layer and regular layer to go through the skin, and after we can put slowly the cones. The two branches of the cones, the V, we go now on the low part to lift the nasolabial fold, but we keep the loop outside. It's very important because now we have to pass the second V of the cones inside the loop to go up in the scalp. To do that, we do a local anesthesia of the scalp to don't have pain and to don't injure the vessels. And we do that very slowly, carefully, and after putting the first V, the first branch of the V, we can put now the second branch of the V in a second vector in the scalp, very carefully, and after we can do a traction, a lift of all the cheekbone. For the lower part of the face, we do a point just under and behind the ear. We do a local anesthesia. We put the first branch of the thread who have to fix the lift, and the second branch will go behind the ear and in the horizontal line of the maxilla inferior. We keep the loop. We can do the first traction. We can put the second V through the loop, and this thread will be longer than the threads who are fixed in the scalp and behind the ear. With 12 cones or 16 cones. Now we are in subcutaneous layer. To go to the commissure, to the marionette lines. And now we can enter the cones inside, and slowly we can push the skin back to lift all the tissues. We see here how to do, after local anesthesia, a little infiltration behind the ear to don't have pain and to don't have any injury. Now we can cut the needle and we see the result immediately. And we see the good result on the oval and dynamic before and after. As you have seen in this video, the patient is relaxed and you can see the result immediately without side effects. You have seen the cross intersection technique. Thank you.